The HELIOS B trial, a phase 3 study of vutrisiran in patients with transthyretin amyloidosis with cardiomyopathy. ATTR cardiomyopathy results from accumulation of wild-type or variant TTR amyloid fibrils in the myocardium. It leads to progressive heart failure, arrhythmia, declining functional status, increased hospitalizations, and reduced survival. Recent advances with tafamidis, SGLT2 inhibitors, and diuretics has resulted in less advanced disease, but this condition is still a fatal, progressive condition with a high unmet clinical need. Vutrisiran is a subcutaneously administered RNA interference therapeutic, which prevents the hepatic production of TTR and is associated with a rapid knockdown of circulating TTR levels. It is already approved in patients with neuropathy. The HELIOS B trial assessed vutrisiran in patients with cardiomyopathy. In this randomized double-blind trial, 655 subjects were randomized to vutrisiran versus placebo. They were followed for up to 36 weeks with an open-label extension. Patients had wild-type or any TTR variant with confirmed ATTR cardiomyopathy and symptomatic heart failure class 3 or less, with an elevated NT-proBNP and a 6-minute walk test greater than 150 meters. Patients at baseline were allowed to be on tafamidis, a TTR stabilizer. Key inclusions included NYHA class 4, a polyneuropathy disability requiring a cane or wheelchair bound, and eGFR less than 30. Baseline characteristics were well balanced across treatment arms, with an average age in the mid-70s, over 90% were male, and a majority of patients being NYHA class 2. Overall, they had a milder form of disease compared to previous trials, reflecting a contemporary population of patients with ATTR cardiomyopathy. Of note, there was substantial use of effective background medications such as tafamidis, SGLT2 inhibitors, and diuretics. Vutrisiran met all the primary and secondary endpoints, demonstrating a treatment effect across a wide range of important, clinically meaningful outcomes. This applies to the overall population as well as a subgroup of patients not on tafamidis at baseline. Vutrisiran reduced the risk of all-cause mortality or time to first cardiovascular event by 28%. There was a nominally significant effect on both components of the primary outcome during the double-blind period, with a 31% reduction in overall mortality and a 27% reduction in recurring cardiovascular events. Of note, all-cause mortality was significantly reduced through 42 months, which included 6 months open label and a pre-specified intention to treat analysis. It was a 36% reduction. The treatment effect was consistent across all pre-specified subgroups of the primary endpoints. It's worth noting the trend towards greater benefit in patients with early disease, such as age less than 75 or NT-proBNP less than 2,000, with a significant reduction in all-cause mortality. There was evidence of a consistent treatment effect also in patients with and without tafamidis at baseline, for the primary co-endpoint as well as the secondary endpoint of all-cause mortality. The vutrisiran monotherapy population showed a statistically significant reduction of the primary co-endpoint of 33% and a 35% reduction of all-cause mortality. In the pre-specified tafamidis subgroup, there was a 22% co-primary endpoint reduction and a 41% reduction of all-cause mortality. Although this subgroup was not powered to show a statistically significant result in this subgroup of patients, these results show the added benefit of vutrisiran on top of tafamidis treatment. There was a favorable effect on multiple measures of disease progression, including 6-minute walk test, KCCQ, and NYHA class. For NYHA class, there was a high proportion of patients with stable or improved NYHA class in vutrisiran patients compared to placebo. For the exploratory endpoint of NT-proBNP, which is a well-established biomarker prognostic of mortality in patients with ATTR cardiomyopathy, the vutrisiran arm had stable NT-proBNP levels compared to the placebo, where there was a steady rise in NT-proBNP levels. Vutrisiran was well tolerated, with the majority of adverse events being mild or moderate and the same frequency in both arms. Cardiac adverse events were similar or lower in the vutrisiran arm as compared to placebo. In conclusion, vutrisiran reduced all-cause mortality and recurrent cardiovascular events. It demonstrated treatment benefits across multiple clinical measures of disease progression, including cardiac biomarkers and a contemporary patient population with high use of background medications. The overall safety profile was good, and the overall results from this trial showed that vutrisiran has the potential to become the standard of care for newly diagnosed patients, but also for those progressing on stabilizers.